Good afternoon and welcome to the weekly update, day 572, week 17 at the EMA office, where we bring you the latest information on our COVID fight. Joined here today with Brian Whitaker, the Assistant Director of EMA, and the Director of the St. Clair County Health Department, Mila Blanford. Mila, we got a lot to talk about today.
We do. Lots of new stuff going on in the county, for sure.
Yes, okay.
Good afternoon, everybody. For the reporting period of September the 30th through October the 6th, we have a total of 418 new positive tests out of a total of 11,731 tests for the reporting period. The age range of those positive individuals is under 1 to in their 80s. The weekly county positivity rate is at 3.6%, with the 7-day rolling average match at 3.6%. The regional positivity rate as of October the 3rd was at 4.2%. We have 3 new deaths to report, all female, 1 in her 70s, 1 in their 80s, and 1 in her 90s, all with unknown health conditions. Countywide, we have conducted a total of 486,139 tests, consisting of 39,657 positives and 446,482 negatives. The total number of deaths to date is 545. Our condolences go out to those families. To date, the number of individuals who have completed their 10-day isolation period is at 38,493. Statewide, we have conducted a total of 32,629,332 tests, consisting of 1,643,993 positives, which is an increase of 19,829 from last week. Total deaths to date is 25,153, which is an increase of 219 from last week. For St. Clair County hospitalization numbers, we have a total of 38 COVID-related hospitalized patients in St. Clair County. Regionally, we're at 86. Patients on ventilators in St. Clair County is at 5, and regionally, we're at 9. And Randy, the hospitals did provide another graphic for this week. So you can see that we have 27 unvaccinated individuals out of 38 that are hospitalized in St. Clair County, 8 that are in the ICU, 0 of which are vaccinated, and 5 on ventilators, 0 of which are vaccinated. If we look at the age breakdown for this past week, we're at 17.8% that they're under the age of 10, 33% are under the age of 20 collectively, and 59.6% are under the age of 40 collectively. Okay. Congregate care for those in outbreak status announcing new cases. Cedar Ridge of Lebanon, 4 new cases. Cedar Trail of Freeburg, 1 new case. Colonnade of O'Fallon, 2 new cases. Freeburg Care Center, 1 new case. Integrity Healthcare of Belleville, 1 new case. So we continue to offer testing Monday, Wednesday, Friday, and Saturday at St. Clair Square from 8 to 4. There's a variety of other options in our community as well, CVS, Walgreens, Med Express. We continue to offer all 3 vaccine types at 330 West Main. We're open from 10 to 6 Monday through Friday and 8 to 4 on Saturday. In addition, we do offer the 3rd dose for Moderna and Pfizer at our 330 location, as well as the booster dose for Pfizer. And all of you know that we did open the fairgrounds yesterday. We gave almost 600 Pfizer doses out yesterday at the fairgrounds. We're open Tuesday, Wednesday, and Thursday from 10 to 8. Appointments are strongly encouraged. However, you can drive up. We will take our last drive-up appointment at 7 p.m. daily. Okay? And today, as of 3 o'clock, we had given almost another 400 Pfizer vaccines at that location. So we're happy to say it looks like everything's going well. It's well received and back up and running as usual.
Well, that's good. We're going to talk about that just a little bit. Brian, you have the zip code report for today?
Yes, sir. So our zip code changes for today: in 62201, we're up 9 to 801. 62203, we're up 5 to 893. 62204 is up 13 to 601. 62205 is up 9 to 935. 62206 is up 15 to 1,964. 62207 is up 10 to 928. 62208 is up 26 to 2,267. 62220 is up 24 to 2,795. 62221 is up 29 to 3,773. 62223 is up 35 to 2,417. 62225 is up 6 to 246. 6225. 6226 is up 47 to 4,275. 62232 is up 18 to 1,180. 62239 is up 18 to 660. 62240 is up 1 to 232. 62243 up 6 to 947. 62254 is up 8 to 970. 62255 is up 3 to 136. 62257 up 13 to 469. 62258 is up 6 to 1,434. 62260 up 4 to 964. 62264 up 5 to 493. 62269 is up 45 to 4,386. 62285 up 18 to 744. And 62289 is up 1 to 61.
Well, thank you, Brian. If my math is right, only 2 zip codes out of the 27 in the county were vacant.
Correct.
Didn't
No,
have
no
anything.
changes in 2 zip codes.
So I think that's an indicator that, you know, the virus is still out there, moving
Still out
around the
there,
county.
Still in
and,
community spread.
so that's why it's important to do what the county is doing on their part. And Mila, you announced we opened up the fairgrounds yesterday. I was there. Chairman Kern was getting updates. He was trying to get here today, but he had another county event he had to take care of. But it seemed to be received yesterday. I was there. Some of the citizens, when they were coming through, talking about how smooth it was. Was you getting that same kind of report?
We definitely were, and we have some of the existing staff that we had prior at our last fairgrounds opening with vaccine. And then we have some new staff as well, and everybody seemed to enjoy. And I always tell the staff, if you're happy, the clients are happy. And if the clients are happy, you're happy. So, and I think, you know, the feedback across the board was great, that the residents were very welcoming and happy to have everybody there, and everybody kind of had a good time. So.
Well, and I think it's worth mentioning to our viewers that follow us every week. We were down there Monday getting some more of the logistics done, and you were out there with the entire staff on the parking lot doing the orientation. So this isn't just where you walk in and turn the key and everything runs by itself.
No.
I mean, it's a team effort.
Right, it definitely is. And like I said, we have collaboration between IEMA, Illinois Department of Public Health, we have contract staffing agency, and we have the health department who has worked relentless hours through all this pandemic. And everybody's very dedicated to what they're doing, and they understand why they're there and what needs to be done.
Well, and I think, you know, it's everybody was saying, well, why were we opening up the Mass site when we had 330 West Main operating? 330 West Main is still in operation. I went there, in fact, Saturday and got my shot. And I got to say, I mean, it was just like clockwork. I mean, everybody was nice, polite. You know, you sign your form, do whatever you have to do, roll your sleeve up and get it, and sit there and wait your 15 minutes, and you're out of there.
Right.
Really no stress whatsoever.
Right, and there's a lot of things coming up. So, you know, there's a difference between a third dose and a booster. Third doses are for those individuals who are moderately to substantially immunocompromised, you've had an organ transplant, immunosuppressive drugs, and that's for Moderna and Pfizer. So if you're interested and you think that you may be eligible for that third dose, you can pull up to 330 and talk to our healthcare professionals, and they can help you make that assessment. The booster dose are for different categories of individuals. Those that are 65 and up should get it. Those who are long-term care residents should get the booster dose. Those who are 18 to 64 with underlying health conditions, which can be asthma, diabetes, COPD, cystic fibrosis, and a variety of other things that we have listed on our website are out there. And then individuals who are 18 to 64 who have an occupation that predisposes them to a greater increased risk of acquiring COVID. So, you know, your transit workers, correctional facility workers, food and agriculture workers, and again, that whole list is out on our website and social media. Those individuals are approved for the booster dose, but booster is for Pfizer only right now. Those individuals who receive Moderna and J&J have been calling and asking when they may be eligible for the booster dose. October the 15th and 16th, the FDA meet to go over Moderna and J&J data, so we'll know more at that time. And then the other thing that's falling on October the 26th, the FDA is meeting to talk about Pfizer doses for those in the 5 to 11 age group. So there's a lot of things that are coming around the bend here in October, so we'll be keeping you posted of any new developments.
Well, and one of the other questions that we had is why only 3 days a week? And as I've explained to the individuals who's asked that, the fairgrounds has been so graciously to us in the past. You know, we had it for 4 or 5 months when they were kind of put on hold with everything. Now they have their weekend business that they have to take, and we want to make sure they're able to do that. So Tuesday, Wednesday, and Thursday at the fairgrounds, and then, like you said, 330 West Main is always open. We're trying to make it as accommodating as possible for the citizens of the county to come in there. So please, there's really no excuse why. It's real simple to get in there, start to finish. From the time they get on the lot, with their waiting time is, what do you think has been averaging?
Maybe 40 minutes, depending. So when you meet with your healthcare professional and they administer the vaccine, they'll ask a series of questions, and from that information, they'll determine whether you need to wait for 15 minutes or 30 minutes, depending on your health history. So once you get through the line and you're vaccinated, you'll go to a monitoring lot where there's medical professionals out there surveying the individuals to make sure no one's having any type of reaction or any issues. And they'll either ask you to stay for 15 or 30 minutes. So with that, most people are still about under 45 minutes.
It's good.
Yep.
It's a good length of time to sit there and know that you're being a part of the solution and taking that step forward to be a part of the solution. I want to give a shout out to the media. We wanted to get the word out about the site opening up, and I think it worked because of all the help of the news media airing it and getting it out there. I know we spent quite a few hours there yesterday, and they were there just getting information, which that's what their job is to help get that kind of community information out there. So to all of you who follow this briefing every week from the news media, we appreciate all the help you give us, and continue to cover what we're doing to try to keep our citizens here in St. Clair County safe. That's what we have for today. If there's any changes between now and next week, we will get back with you. And thanks, Mila, for all the work, and let the staff know that on behalf of all of the county residents, I know they appreciate it.
And we appreciate our community. And again, big kudos to the health department staff who have been in this since the beginning and stay true to their goals.
Very good. Thank you, and we'll see you back here next week unless something comes up. Everybody have a good rest of the evening.